factors are considered when deciding on the best treatment approach for an individual patient?
So I think certainly, the tumor type, like we talked about, is it estrogen positive or triple negative or HER2 positive? I think response to past treatments, both in terms of, if someone has had metastatic disease for a long time and has had a few treatments already, how long did they respond to those treatments and how completely did they respond to those treatments? Did they just have sort of stable disease for a while, or did their cancer actively shrink? And then I think, other than that, it would be sort of some of the things I've touched on, side effect profiles. Do patients have pre-existing neuropathy from other chemotherapy? If so, maybe you want to avoid a regimen that causes more neuropathy. Schedule, some patients, it's really important to be on a certain schedule as opposed to a different schedule. I think whether there are clinical trials available instead of whatever the standard of care regimen would be is also important, because for some patients, who are interested in sort of pushing the envelope or who might be a great candidate for a particular trial, if there is one that they're a candidate for that's, not horribly inconvenient from a logistics standpoint, then trials, I think, are also a great option to consider. So I think, from a effectiveness standpoint, you want to think about the tumor type, response to past treatments, and then potentially if the patient has had what we call genomic profiling, where the tumor has been sent for basically genomic analysis to see what genes might be mutated in the tumor that could potentially drive a response to a new or different therapy. All those things could be taken into account as we think about the cancer, but then there's sort of the patient-specific factors. And I think those would be mainly side effects, schedule, clinical trials, and desire or not to pursue those. And then, just kind of what the patient's perspective is on the plan that you're offering them.